Hello everyone, welcome back to our channel. Today we're diving into a topic that's rarely discussed openly but incredibly important for men in their later years: sexual health and well-being. I know this subject can feel a bit uncomfortable, but trust me, it's worth addressing because maintaining a healthy sexual life as you age can significantly enhance your overall quality of life. Before we start, please take a moment to subscribe to our channel. Your support helps us continue bringing valuable content on health and wellness. Also, let us know in the comments, how do you think sexual health changes as men age? Your thoughts and questions are always welcome. Now let's address a topic that's often neglected. Have you ever noticed how some men in their 70s and 80s remain vibrant, mentally sharp, and physically active, while others seem to lose their vitality much earlier? One surprising factor that can make a huge difference is maintaining a healthy relationship with self-pleasure and sexual expression. According to Dr. Alan Thompson, a leading expert in men's health and aging, regular sexual activity, including masturbation, can help maintain cognitive function, cardiovascular health, and even emotional well-being. One of the biggest misconceptions about aging is that sexual desire naturally fades away, or that it becomes inappropriate to maintain an active sexual life after a certain age. Dr. Thompson challenges this notion by emphasizing that sexuality remains an integral part of human experience well into advanced age. While some physical changes are inevitable, like lower testosterone levels or reduced spontaneous arousal, the need for physical pleasure and connection doesn't disappear. In fact, abandoning sexual expression can accelerate cognitive decline and diminish overall vitality. The problem is not just biological. Cultural taboos and misinformation play a big role in why many older men feel they must give up this aspect of themselves. Dr. Thompson explains that many men internalize societal messages suggesting that sexuality has an expiration date. Combine this with health challenges like erectile dysfunction, loss of a partner, or lifestyle changes like moving to assisted living, and it's easy to see why many men withdraw from sexual activity. But here's the encouraging news. You don't have to surrender this part of your life. Maintaining regular sexual activity, even through self-pleasure, can stimulate the release of hormones that are vital for maintaining muscle mass, bone density, and mental health. Regular ejaculation, whether through partnered sex or masturbation, helps increase blood flow, supports prostate health, and reduces stress by releasing endorphins. Research from the University of California has shown that men who maintain sexual activity into their later years are more likely to experience lower rates of cardiovascular disease and better cognitive function compared to those who become sexually inactive. This is partly due to the hormonal benefits of regular sexual expression, including increased testosterone and oxytocin, which help maintain a positive mood and reduce anxiety. One of the most significant barriers to maintaining sexual health is the mindset that it's not worth the effort. Dr. Thompson emphasizes that changing this perception is the first step. Viewing self-pleasure as a normal, healthy practice rather than a sign of loneliness or inadequacy can empower men to reclaim this part of their lives without guilt or shame. It's important to recognize that your sexual health is interconnected with your overall well-being. Just as physical exercise and balanced nutrition are vital for healthy aging, so too is the practice of maintaining sexual expression. Think of it as a form of self-care that not only preserves function, but also contributes to emotional and psychological resilience. For many men, the key to success lies in adapting techniques to suit their changing bodies. Dr. Thompson suggests focusing on sensation rather than performance, experimenting with different forms of touch, and taking time to relax before engaging in sexual activity. Creating a comfortable private space where you feel safe to explore can make all the difference. Use quality lubricants to enhance comfort, especially as natural lubrication may decrease with age. One technique that many men find beneficial is practicing mindful self-pleasure, where the goal is not necessarily orgasm, but rather reconnecting with one's body. Taking time to breathe deeply, relax, and focus on pleasant sensations without pressure can transform the experience from one of frustration to one of self-discovery and rejuvenation. Dr. Alan Thompson, a respected voice in men's health, emphasizes that misconceptions can significantly hinder one's ability to maintain a healthy, satisfying sex life as they age. Let's break down some of these myths and learn the truth behind them. Myth 1. Sexual desire naturally disappears with age. While it's true that hormonal changes can affect libido, the reality is far more nuanced. Dr. Thompson points out that many factors, including stress, medications, and underlying health conditions, play a much more significant role in reduced desire than aging itself. In fact, many men maintain strong sexual interests well into their senior years when they prioritize their health and well-being. Myth 2. Erectile dysfunction is an unavoidable part of aging. While ED becomes more common as men get older, it's not inevitable. Many cases are linked to treatable conditions like diabetes, cardiovascular disease, or lifestyle factors such as smoking and lack of exercise. Addressing these underlying issues can often improve sexual function significantly. Now that we've debunked some of the most common myths about sexuality and aging, it's time to focus on practical strategies to help maintain sexual vitality as you grow older. Dr. Alan Thompson, with decades of experience in men's health, emphasizes that staying sexually active is not just about maintaining physical ability, but also about nurturing emotional well-being and self-confidence. One of the first steps is to adopt a proactive approach to sexual health. Just as you wouldn't wait for a muscle to weaken before starting to exercise, maintaining sexual health requires consistent effort. Start by prioritizing your overall well-being, including regular physical activity, a balanced diet, and managing stress. These foundational aspects support healthy blood flow, hormone balance, and mood, all critical for maintaining sexual function. Exercise in particular plays a crucial role. Dr. Thompson recommends incorporating both cardiovascular workouts and strength training into your routine. Aerobic exercises like walking, swimming, or cycling help maintain heart health, which is essential for erectile function. Strength training, on the other hand, supports muscle mass and testosterone production, helping you feel more energetic and vital. Another critical factor is sleep. Quality sleep is directly linked to hormonal health, including testosterone levels. Studies have shown that men who consistently get at least 7 to 8 hours of sleep per night tend to have higher testosterone levels compared to those who sleep less. Establishing a bedtime routine, minimizing screen time before bed, and creating a restful environment can all contribute to better sleep quality. Nutrition also plays a fundamental role in sexual vitality. Focus on a diet rich in whole grains, lean proteins, healthy fats, and plenty of vegetables. Foods high in antioxidants, such as berries, leafy greens, and nuts, support vascular health, which is crucial for erectile function. Additionally, include foods that naturally boost testosterone, like eggs, fatty fish, and pumpkin seeds. Dr. Thompson particularly advocates for a Mediterranean-style diet, which has been linked to improved heart health and better sexual function. Don't overlook the importance of staying mentally engaged. Mental stimulation and maintaining social connections can positively impact mood and libido. Engaging in hobbies, learning new skills, or maintaining close friendships can help keep your mind sharp and your spirits high, indirectly benefiting your sexual health. When it comes to sexual practices, focus on quality rather than frequency. As bodies change with age, the nature of sexual expression may evolve. Instead of stressing over maintaining the same patterns as in youth, embrace the opportunity to explore new ways of connecting. This might include more extended foreplay, experimenting with different forms of touch, or focusing on intimacy and closeness rather than just the act itself. Dr. Thompson suggests incorporating relaxation techniques like deep breathing, meditation, or mindfulness to reduce anxiety and enhance arousal. Anxiety can create a mental block that interferes with sexual function, so finding ways to relax can make a significant difference. Communication is another key element. If you have a partner, discuss your feelings and any changes you're experiencing. Sharing your thoughts can reduce feelings of isolation and help you both find enjoyable ways to maintain intimacy. Remember, it's normal for desires and needs to evolve over time. and being open about these changes fosters a supportive and understanding environment. If physical changes like erectile dysfunction are a concern, don't hesitate to speak with a healthcare provider. Many effective treatments are available, from lifestyle adjustments to medical interventions. Dr. Thompson stresses that seeking help is not a sign of weakness, but a proactive step toward maintaining your quality of life. Sometimes, simple changes, like adjusting medications or incorporating pelvic floor exercises, can significantly improve outcomes. Pelvic floor exercises, often associated with women, can also benefit men by strengthening the muscles involved in urinary and sexual function. Regular practice can help improve bladder control and support stronger erections. Try doing Kegel exercises daily. Tighten the pelvic muscles as if stopping urine flow. Hold for a few seconds, then release. Repeat this process 10 to 15 times per session. Another helpful practice is sensate focus, a technique developed to reduce performance pressure. Start by focusing on non-genital touch with your partner, gradually building to more intimate contact, without the expectation of intercourse. This approach helps rebuild confidence and physical connection, without the stress of performance. When adapting your routine, be patient and kind to yourself. It's normal for your body to respond differently than it did in your younger years. Focus on pleasure and connection, rather than measuring success solely by performance. This mindset shift allows you to enjoy intimacy more fully. Finally, don't underestimate the power of positive self-talk and self-acceptance. Dr. Thompson encourages men to let go of comparisons to their younger selves and instead embrace their current stage of life. Recognize that your worth and ability to experience pleasure are not defined solely by physical function. Cultivating a positive attitude toward your sexuality will naturally enhance your confidence and satisfaction. To wrap up, maintaining sexual vitality as you age is not just about preserving physical capabilities, but about embracing a holistic approach that includes mental, emotional, and relational well-being. By staying active, prioritizing your health, and being open to new experiences, you can continue to enjoy a fulfilling and meaningful sex life. Thank you for staying with us throughout this video. If you found these insights helpful, don't forget to like, share, and subscribe. Your support helps us continue bringing valuable content on health and wellness. Feel free to share your thoughts in the comments, and let us know what topics you'd like us to cover next.